So here's our agenda for today. We're going to be going over what we do and who we are as as a We program. Just a really quick, like sort of tobacco 101 that we'll be covering. And then we'll be doing an overview of the leadership development program, which will include a Q&A, and then we'll be closing. So now just going into like what we do and who we are. So We Breathe, which is the LGBTQ plus statewide coordinating center, is our parent organization is the LGBTQ plus Health and Human Services Network. We have three of our members of our staff present right now. So myself, I am the We Breathe program coordinator. We have Isaias, who is the program manager. And then we have Ari here, who is our communication specialist. So just a bit about myself. My name's Ryan, and my pronouns are he, him. And I am half Asian and half Latine, so I'm half Japanese and half Mexican. I'm queer, I'm out to my family. And I do experience things like depression and OCD. So I think a lot of these different like experiences and identities that I hold have definitely like just basically shaped a lot of my experiences in and out of the workplace. And I try to be really open about different things that I've experienced in my life, just because I think that, especially working in public health, like a lot of these different things are definitely relevant and connected to the work that I do as a We Breathe program coordinator. And there's also my little cat. Her name's Mystique. I call her Kitty Girl. And yeah, I love her very much.
Hi everyone. So my name is Isaias Guzman. I'm the manager of programs here at the network. My pronouns are he, him, and his. And a little bit about myself as well. I'm a first generation Latinx born in the US. My identities includes being cis, queer, gay. I'm out to family. I'm able-bodied. And I also have a puppy. Well, not also, but I also have a pet, but I don't have a picture today. But who I adopted recently. So excited to include that in future presentations. But yeah, that's a little bit about me.
Ari, if you wanted to just introduce yourself as well.
Yeah, good morning, everyone. My name is Ariela. I also go by Ari, she, her pronouns. I'm the communication specialist with the network. And yeah, I definitely help out with We Breathe and all communication aspects from educational materials to consumer testing, along with our communication subcommittee. Um, and yeah, it's important work to also highlight this issue of tobacco use amongst our communities, among many other health equity issues that we face. So if you're ever interested in just getting involved, not only with this program, but like with our general communications, yeah, feel free to reach out and get involved that way. But yeah, also if you have any questions, I'll be monitoring the chat along through the webinars. So yeah, feel free to use the Q&A function as well. Thanks, Ryan.
Thank you, Ari. So, this is just kind of a very broad mission statement about what, we as We Breathe do. So I'll just go ahead and read this. So part of our mission is to provide a basic foundation on tobacco-related disparities the LGBTQ plus community faces, and how the LGBTQ statewide coordinating center is available to assist in eliminating tobacco usage in California by 2035. So, again, I think a lot of the work that we're trying to do as the statewide coordinating center is specifically just around like helping to educate and empower people within our community to be able to work around the fields of public health and the intersection between tobacco use and like mental health within our community. So these are just like different services that we directly provide as the coordinating center. Some of these include like research, we provide technical assistance, we develop educational materials, we advocate around these issues, whether it comes to like policy. And we also, this is why we're all here today, is to talk about leadership development. So we are launching our leadership development program. It'll be, this is this is a new sort of program, I believe, in terms of like the work that We Breathe does. So we're really hopeful just to be able to talk more about for y'all to learn about like what our plans are for this program. So just a bit about the educational materials that we create. So these are two examples of just like how we try to present information around tobacco usage and how it specifically impacts the LGBTQ plus community. So one example would have to be like for transgender and non-binary folks who are looking to get like gender affirming care. A lot of doctors will in fact like postpone or delay life-saving surgeries and other treatments that are used for people who are seeking gender affirming care. So a doctor might just be like, hey, I'm not going to perform top surgery on you because you use tobacco. And a lot of that does have to do with like some research showing that tobacco usage prevents or decreases the body's ability to heal from like things like surgeries and other things like that. So that's why a lot of doctors will want to postpone these types of this type of care. Of course, there's a lot of like implications with that because I definitely would argue that gender affirming care is not something that should be delayed. But the reality within the medical community is that unfortunately this is something that like a lot of doctors will not perform if you are using tobacco. And that's just one of many examples of how tobacco usage specifically impacts the LGBTQ plus community in a different way that it might for people who are cisgender and straight. So just want to use that as an example. We also do have some stuff around like materials around like how HIV and tobacco use intersect and just like how why exactly that's like a specific area that we want to be able to be creating educational materials around. In addition to that, we do also offer trainings to help and workshops to build capacity within different organizations and agencies. So basically some of these a lot of times are around like how to better understand LGBTQ plus identities and how to be able to engage our community in rural settings or even in like big cities like Los Angeles or San Francisco. So again, a lot of these trainings are basically trying to empower our partners to be able to take on this work. Some of this also too just has to do with more general sort of like advocacy and trying to raise awareness around our community. So one of these trainings includes like LGBTQ voices in commercial tobacco control. So just trying to elevate voices that are often left out of this type of work that we're doing. And then we also do research and data collection. There's unfortunately a lot of gaps in LGBTQ plus tobacco use data, and not even just tobacco use data, but just generally across the board, like a lot of different fields in public health. There's a lot of data that's missing, particularly for those who are transgender, non-binary, and intersex. And we're trying to change that. And a lot of that just includes collecting data around like public intercept surveys and then doing key informant interviews. So again, we're definitely trying to increase the amount of data that's available, especially for parts of our communities that have been historically left out of surveys and data that has been collected in the past. So, again, data equity is definitely part of the work that we're trying to work to the goal that we're trying to work towards. And yeah. Next, I just want to talk briefly about just our policy platform recommendations. So we did release our policy platform, which includes a lot of recommendations for the statewide California tobacco control program. A lot of these things have to do around like trying to address environmental changes going on, and then also just that we do need to be, as advocates for tobacco control, like we do need to be addressing things such as like we need to be working towards being more culturally sensitive and having cultural humility in these spaces. In addition to that, there are a lot more things for like research that we need to be addressing. So as I mentioned before, there are tons of gaps in public health data that unfortunately, like, as advocates, we need to be doing a better job to be collecting, and we're trying to be the model for that. In addition to just funding recommendations, so just how exactly is this money being spent within, this field of tobacco control, and how can it become more equitable? And also too, just general guidance. I mean, we need to be listening to members of our community in terms of like what the needs of the community are. And sometimes I think public health can get a little bit like detached from the, from the ground, if that makes sense. And I think part of the work that we're trying to do is just making sure that we are staying connected to our community, making sure that our recommendations are based on actual needs from that we hear from the ground rather than just trying to make assumptions. If anyone does want to, so here are the two links to our policy platform, our full policy platform. So if anyone's interested in having access to that, please feel free, we encourage y'all to read it. Some of these recommendations do include like taking out policing from tobacco control work, because we definitely don't want for members of our community to be criminalized. We also recognize that a lot of, especially communities of color and queer people of color, have experienced a lot of traumatic trauma when it comes to law enforcement. So that's why we strongly advocate, for instance, for law enforcement to not be involved in a lot of the policy work that we might be working on. So that's just one example of a recommendation that was made in our policy platform. So now let's be moving quickly into Tobacco 101. And, I recognize a lot of us here might be familiar with this, but for those who are not, this is kind of, we just wanted to include this section here because we're not expecting everyone who's applying for this leadership development program to be coming in as an expert. So, tobacco, the tobacco industry for decades has definitely targeted our community through ads. These are more recent advertisements that were featured on social media. A lot of historically, a lot of the tobacco industry's advertisements have included themes around like pride and feeling proud of our identity while also using vapes or cigarettes. And again, I think it's supposed to be just be try an attempt to try to tie tobacco usage to feelings of pride and empowerment that a lot of us are trying to look for, right, as queer people. They've also featured, a lot of advertisements over the decades have included drag queens, queer people in them. And again, these are just attempts to be able to seem like they're our ally, to seem like they have our back, when in reality, like these products are not only addicting us to them, but also decreasing our life expectancy. So, and again, I just wanted to kind of mention this one, which is just like, I love this one that talks about like happy LGBT pride from your friends. And I'm just like, you're not our friends. Y'all are wanting our money and wanting to addict us. And again, I think that's part of the work that we're trying to do is try to break away from this narrative that the tobacco industry has our backs and is here to support us, during Pride Month or other parts of the year. So, and the result has, part of this has resulted in, LGBT, lesbian, gay, and bisexual youth currently using tobacco at higher rates than other than heterosexual youth. And then more than half of lesbian, gay, and bisexual youth have tried e-cigarettes. And I wanted to specifically mention that the reason that this statistic does not include transgender and non-binary youth is because, again, there's just a lot of missing data that we're trying to work to collect right now. And unfortunately, like because this data is missing, like we don't exactly have the full picture. We don't exactly have a full picture of how exactly things like e-cigarettes are impacting our community. But we do, based on the limited data that does exist, though, we definitely do know that transgender youth of color do use vape products at higher rates than their cisgender and white counterparts. So again, there's a lot of missing data, but the picture, but we do already know that, especially for transgender people of color, tobacco usage rate is much, much higher than other groups are, even within even within other parts of the LGBTQ plus community. And the result, the long-term result is just a lot of these different things that tobacco usage can cause. So it increases your risk of things like cervical cancer or premature aging or tooth loss or erectile dysfunction. So I don't say all this stuff just to scare us, but I am just trying to kind of use this as, that this is these are part of the reasons why tobacco does decrease LGBTQ plus life expectancy. And part of the reason too why we're trying to address this, because we don't want our community, especially those who are less likely to have access to things like health insurance or full-time employment. A lot of these different things that tobacco usage is causing can be even more difficult for our community to be able to have treatments for or have access to medical care. So now I'll be handing it over to Isaias to start going over the overview of the leadership development program.
Yeah, thank you, Ryan. So today we want to talk about the RFP application and what the program entails once you're contracted with us. So first and foremost, the purpose of the We Breathe Leadership Program is to support emerging leaders to better understand the interconnections between LGBTQ issues and LGBT communities and tobacco use and its relationship among those two topics. We want to support people and organizations who have either been not connected in tobacco control or are involved in LGBTQ advocacy and are interested in getting involved in LGBTQ tobacco control work and efforts. This is the type of program that that's the type of applicants that we want in the program, and why we developed it is to support folks in helping them gain capacity, skills, and tools to engage in these spaces. Some of the skills that you'll be learning in the program can include LGBTQ data collection, community organizing, policy advocacy, the development of materials and resources, and event planning. And we, hope to foster collaboration and networking between the participants and our other program contractors. So in terms of what we're looking for, we're looking for folks who are based in California, and eligibility can include either individuals and organizations. So if you want to apply on behalf of your organization, you're more than welcome to do so. But if you're interested in applying as an individual, as a consultant as well, that is also a possibility. And so we're looking for folks who are either part of the LGBT community and allies who are interested and committed in LGBTQ health equity. We are not necessarily looking for folks who are experts in tobacco control, because we understand tobacco control is not a common issue that our communities engage in. And so if you already have done work with us in the past on tobacco control issues, that's great. If you haven't, that's not going to hurt you in the application process. Yeah, so those are the primary qualifications. And if we can go to the next slide. So the RFP application is now open. The program leadership development training that will provide direct training and professional development for grantees. Will be $5,000 for up to 5 organizations and or individuals, and it will be for the length of November, excuse me, from November to June. And so the amount will be $5,000 for about a 7-month period of work. Okay, so there are 2 required deliverables that will be needed for all applicants. And these 2 deliverables include participating in quarterly meetings with our program coordinator to receive training, support, and guidance that will culminate in the development and or participation of the capstone project. So these these will be opportunities for folks to get skills and trainings on the capstone project itself to be able to complete that that project. And it will also be used as an opportunity for folks to network with one another. And also, if you have any questions on the specific deliverables, those meetings will be an opportunity to answer any questions on the contract itself. The second responsibility that's required is participating at least 3 times on monthly network calls. These network calls are, many of you already attend, but for those who may not know, we hold a network call every month to all of our partners, where we provide updates, policy updates, program updates, announcements, and an opportunity for our partners to share their own events and local events that are happening in their own communities. And so the expectation would be for our contractors to attend at least 3 times for the length of the contract, and potentially provide 1 or 2 updates of any local type of updates from your organization and during those calls. Or you can also be sharing those updates through our listserv. So next slide. So now that we've gone over the 2 required deliverables, this slide focuses on what you can actually select for your capstone project. And so there are 2 options for your capstone project, and that's one of the options is assisting in the development of up to 2 community forums. And that can involve participating in the planning committee to support the event program development, the logistics, outreach, recruitment, and more. And the second option is to help develop up to 5 tobacco-related LGBTQ plus educational materials, which can include brochures, fact sheets, infographics, or videos. The development of educational materials can include the creation of them using Canva or other illustration software. It can also include providing feedback and consumer testing existing education materials that are created by the communications coordinator specialist. And so this deliverable can range from developing your own infographic or brochure to providing feedback on existing materials or materials that are developed by our communications specialists. So other tasks can include helping create a communication strategic plan, social media strategy, and providing input on these issues. So if you are interested, experience in communications and or digital art design is preferred. So that way we can help develop those skills around how to create these types of different materials for the program. Yeah, so if we can go to the next slide. So in terms of the quarterly meeting, we will be holding training sessions every 2 to 3 months that includes topics on LGBTQ data collection, community organizing, how to engage policymakers, how to make public comment, and more. We will also be asking folks and organizations who are accepted into the program what type of trainings they will prefer and want from us to help them grow their skill sets and to help them better accomplish the capstone project. In terms of the network calls, again, once a month, we host a check-in to share updates with all of our partners. And during these meetings, you'll have an opportunity to share a couple updates about your organization or any updates that you might have about your programs or events that are happening. And they do not have to be tobacco related. So our expectation really is to attend the meetings and engage in them in the ways that you see fit. And you can use this opportunity to showcase what your organization is doing. For the community forums, if you chose this as your capstone project, you will be involved in helping create an event to engage LGBTQ people and allies in tobacco control work, and create a venue to discuss the intersections of tobacco control and the social determinants of health, and how there's a connection of tobacco use. There's a connection between tobacco use and our other issues that are pertinent in our communities. And so in our previous community forum that we had this past August, we focused the theme of the event around mental health and tobacco use and the interconnection between them. So there's a lot of ways that a community forum can look like. And if you become a participant of the program and you select the community forum, you'll be helping develop these topics and themes, and helping outreach for the events and designing the content of the event, and supporting the creation of it. So you'll be working closely with Ryan, who's our program coordinator, on this specific deliverable. For our second capstone project option, this is the development of the education materials. The goal of this specific deliverable is to tailor fact sheets and information around tobacco control and tobacco use for an LGBTQ audience. And so for this deliverable, you will be working closely with Ariella, who is our communication specialist. Often the types of materials that we tailor it to, the types of audiences, include LGBTQ youth, BIPOC communities, policymakers, and more. There's no limit to what an education material can look like. And so the development of an education material can range from different mediums based on your choosing, and in partnership with our communication specialists. In addition to this, you will probably be supporting our communications efforts by participating in a communication subcommittee, where you'll have an opportunity to provide input on a communications strategic plan, on helping provide input on existing materials and consumer testing materials, and much more. So if you're interested in comms, or more of the arts types of person who wants to work around digital media, digital art, this is really a good opportunity to engage and build on those skills, as well as developing materials on Canva. So We Breathe will be conducting an orientation in November with each subcontractor to make sure that you have the necessary materials to succeed. We will be also providing updates during the network calls every month. And we'll also have the quarterly meetings with all partners to make sure that you all have the tools for success. Okay, next slide. And so in terms of eligibility, it's pretty, hopefully it's straightforward, but if not, then we can go over it right now. But all you need to do is submit the online application, which has been provided. And if you're applying as an organization, a copy of your 501c3 letter from the IRS, including your tax ID. And if you are an individual, a completed IRS for W-9 IRS form. And these documents need to be uploaded on the online application. So in addition to the rest of the application, there's a section at the end in which you can upload these documents, depending on whether you're applying as an organization or individual. And the deadline to submit your application must be by 11:59 p.m. on October 12th. And now we're gonna set some time for Q&A. So if you have any questions about anything related to the RFP, the deliverables, the contract, this is the time to share your questions and comments.
Isai, there is one question about just whether or not the outreach events are virtual in person.
Yeah, great question. The community forums will be in person. We've done them in person. And I expect it to be in person as well. And any cost in terms of travel would be covered. So if you're in San Francisco and we have and the community forums are hosted in Los Angeles, that would be those costs would be covered. And vice versa, if it's in the Bay Area and you're from LA or from Southern California, that would be covered as well. I will say that our next community forum will be held in Los Angeles. Our community forum is scheduled for April, so if you do select that option, just heads up that we know that we'll be having it in Los Angeles.
Are there any other, does anyone have any other questions or any thoughts? If not, then I guess we're good to close out unless there's any additional information that Isaias that we wanted to share before we hop off.
There's a few more slides, correct?
Oh, oops. Thanks, Isaias. So yeah, just here's the flyer once again for anyone who's looking to apply. The QR code, and then I know Ari just posted, I think Ari just posted the link once again. So thanks, Ari, for sharing that. So basically, yes, the application will be due October 12th, and the program will run from November 2023 to June 2024. So please apply if you're interested. And again, we're not looking for we're not looking necessarily for people who are experts in tobacco control, but it's open to anyone who either wants to begin working in this or who is just interested in learning more, and especially those who are looking to develop more leadership skills within the field of public health. So, and again, it's open to organizations and individuals. We also did just want to mention that our sibling program, which is the Out Against Big Tobacco Los Angeles program, they are also holding an additional webinar similar to this one next week on October 10th from 10 a.m. to 11 a.m. Please use the flyer to register for that. It's going to be just basically covering similar things. Of course, there are going to be differences between our program and the Los Angeles, the Out Against Big Tobacco LA program. But it'll be it's just an additional funding opportunity that our organization is holding. I did just want to mention that for our partners present right now who are located in Los Angeles, you are actually able to apply for multiple grants at one time. So hypothetically, you could get the We Breathe grant and the Out Against Big Tobacco LA grant. It is only open to partners who are located in Los Angeles, however. So if you're located in other parts of the state, unfortunately, this program's not is not this funding opportunity might not be open to you. So just wanted to throw that out there. But yeah, it'll be hosted by our colleague Jessica next week. So please feel free to attend that if you're interested in learning more about this additional funding opportunity that'll be open. So thank you everyone for attending our webinar. And we greatly appreciate your attention and also presence. So please feel free to apply. Again, the deadline's October 12th by 11:59 p.m. We hope to see some applications come in and look forward to the possibility of working with some of y'all more closely.
Yeah, and I before we go, I do want to reiterate the We Breathe leadership development program is statewide. So as long as you're in California, you can apply to that. And for the Out Against Big Tobacco, it's in Los Angeles. So yeah.
Yeah, thanks, Isas, for mentioning that. Yep, you can be located any part of the state, Central Valley, Bay Area, Northern California, LA, San Diego, like wherever you're in the state, as long as you're in California. So thanks everyone, and hope everyone has a great rest of your day, and hope to be able to see some more applications.